you so much, Angel. We are very excited to be here today, and I am going to let Wanda share a few words.
Thank you, everyone. Good morning, good afternoon. Thank you, Angel. Just by way of introduction, I am a co-director of New York Presbyterian Hospital's Family Peace Trauma Treatment Center. And at the center, we dedicate ourselves to serving families with young children ages 0 to 5 that have been exposed to any type of trauma, although it is mostly interpersonal traumas that we are working with. Go ahead, Carmen.
Thank you. And as Angel mentioned, I work at the Child Witness to Violence Project at Boston Medical Center, and we also provide services to families with young children ages 0 to 8. Many of the families that come to our hospital are immigrant families, and we have the opportunity to provide services at no cost. So we do see many families who are undocumented, particularly Latin American families. So some of the lessons and reflections that I am going to share today are based on my work and the stories that our families at Child Witness have shared. Next slide, please. So today we are hoping to identify the impact of COVID-19 and existing inequities, particularly in Latin American families, and recognize the increase in intimate partner violence and its impact from the perspective of the parent, the child, the relationship, the with and hold multiple lenses.
We're also wanting to identify different support or intervention strategies, looking at the socio-cultural context of these families, of course, child development and the relationship and the trauma that they have experienced. And we will be finishing up with talking about advocacy and public policy implications related to Latin American families during COVID and intimate partner violence. Next slide, please.
We will be talking today about inequities, violence, the intersection of immigration trauma and intimate partner abuse and other potentially traumatic experiences. So we want everyone to remember that that it's important to be aware of how what we are listening might be impacting us, and to pay attention to our emotions and reactions, and to keep your well-being in mind and your self-care, and to feel that you have the permission to do whatever you need to do to preserve it. And if you are participating, which we hope that this will be a very participatory um, session, to please avoid sharing your personal case. And then if any stories are shared, to maintain confidentiality. Next slide, please. So we wanted to, can you go back? We wanted to start with a reflection, and we were wondering what have been your experiences and observations related to the families that you serve, particularly in relation to domestic violence and COVID-19, to that intersection. Um, if you can share um, that via chat, we will be happy to to reflect on your experiences. Okay. Anything that I cannot see the chat now, so anything that.
distance from the usual engagements.
Mm-hmm. What else?
I worry that a lot of violence is going unreported because we cannot go into the home as often. Increased control from the abuser.
Mm-hmm. Thank you. Yeah, all of those are very significant concerns for all of us. And as the as the reality of the pandemic was hitting us, we in my case we stopped seeing families in person, and then we knew that some families, in particularly because we serve the majority of clients that we serve, who we serve are women. So that was, and we knew that they were in a very vulnerable place. So we knew that the probability of going back with an abuser or being the target of abuse was pretty high. Next slide, please.
Just other reflections really
Mhm.
quickly. Some people said clients canceling visits because he's at home. The person being abused doesn't call for help because due to COVID, they may not have a place to go. And one person, a client called the hotline while he left and she's in shelter right now.
Yeah. Anything you want to add, Wanda?
I mean, I think all those are common experiences that we're all having, having to adjust to this virtual world and the safety concerns of not knowing who's present in the home, and how a person is being impacted by lack of safety due to COVID and being stuck in the home.
Yeah. Thank you for all of you who shared your impressions in your reflections on the chat. In the interest of time, I am going to move to the next slide, which is also related to this topic. And now it's not news that the impact of COVID-19 has affected or illuminated rather the inequities existing in the world and in the United States, as well as the majority of people who have been affected are people of color, are the elderly, and particularly women, and those who are in that group, those who are undocumented. So COVID-19, everybody says that it's a sort of an equalizer, and I disagree with that because it has had a significant impact on those who are oppressed. And these group of families that we will be discussing today are some, particularly women, are some of the most affected. Next slide, please. So just to illustrate this, in the United States, as of October 15 of 2020, 1 in 920 African Americans has died, or 108 108 deaths per 100,000 people. That is the representation of 1 in 1,100 Native Americans have died. 1 in 1,360 Latin Americans has died. 1 in 1,450 Pacific Islander Americans have died, and 1 in 1,840 white Americans has died. 1 in 2,200 Asian Americans has died. So this is illustrating how the disproportionate impact, particularly in people of color. Next slide, please. So in thinking, reflecting about Latin American individuals as October of 2020, Latin American residents in the United States are 2.1 times more likely to be infected with COVID-19 and 1.5 times more likely to die from the virus than their white neighbors. Um, also, they are 3.2 times more likely to die from the virus that compared to their white neighbors if we take into account age. So we think about people who are over 50. Um, and next slide, please. And relating, connecting these numbers to the next slide, there were existing disparities for many Latin American families before the impact of COVID-19. If we think about this administration, the prior administration in terms of immigration policy, that created a lot of risks for many families, undocumented families and mixed status families, as there were, for instance, many concerns about eh, accessing services. And then I am thinking particularly with this administration about um, public charge, and that in itself created gaps. So I think about examples with some of the families who I serve who disenrolled from services, and then at the moment when COVID-19 hit, they didn't have a safety net, and that increased the risk for the risk for not having enough support, but then also not being misinformed. And the misinformation was another important aspect as COVID-19 hit. And I think particularly, and it continues, initially the information was very confusing for all of us, but the information was not translated properly or was not targeted to or developed in a culturally appropriate way to make sense to the Latin American community. Um, as we know, as I know, particularly for the families I serve, they live in multi-generational households, as they need to save money, or it's very difficult, and particularly now it's extremely difficult to find housing, or with the loss of jobs, families have become homeless, and that increases the risk for contagion. Then with the closure of schools, business, and churches, that had a significant financial impact that also reflects in health disparities. And as we know, the Latin American community have been essential workers. Many of the parents who I work with never stop working, and that also increases the risk. And with all of these, with the lack of housing, the lack of financial support, many women, or many individuals who were in abusive relationships in the past, and who were able to secure a place to live away from the abuser, were placed in a situation where they went back to the abuser, or the if the abuser was already living at home, the possibility of seeking help, or moving away from that relationship became almost impossible. Next slide, please.
So just to, I'm sure many of you are aware of exactly what intimate partner violence means, but to sort of establish a foundational language of the definition of intimate partner violence, it's a pattern of behaviors used by one partner to maintain power and control over another partner in an intimate relationship. And so what happens is that there's a power imbalance. There's this dynamic of power and control where one partner has power and control over the other. You know, it tends to be that it's rarely an isolated incident. It's really a pattern of coercive behaviors that happen between the two. And it's aimed at establishing intimidation and control in the relationship. And it usually carries an element of fear. Next slide, please. So to talk a little bit about statistics in terms of Latinx women, we know that 1 in 3 Latina women reported being victims of violence or sexual or physical harassment by an intimate partner. And this is similar to the overall rate of women of 37.3% according to the CDC. Next slide. So what we've seen, and I think this is some of the things that were mentioned earlier in the chat, you know, mechanisms of control that are being used by the aggressor during the pandemic have been things like misinformation about the virus. So that's increasing fear and control for the partner. An aggressor could retain items that are important, such as antiseptic gel or disinfectants, things that are important for the health of everyone in the household. And then there are things like threats of deportation for undocumented immigrants. And so, you know, this really creates a situation where people are fearful of going to get medical care because they are worried that they will be deported possibly. And of course, limiting access to communication with different support systems. So isolating people from families, not allowing people to leave or communicate with others outside of the home, which, as you can imagine, of course, is more difficult in the midst of a pandemic and lockdown orders. Again, in terms of health and safety, restriction of the use of insurance cards and other things that are relevant to get health care, and then misinformation about legal remedies that may be available to someone. As you can imagine, if there are people that are undocumented, new to this country, they may not know how to navigate systems, and an abuser could be misinforming or keeping information from a partner that would be helpful to them. Next slide, please. So let's talk a little bit about protective and risk factors specific to Latinx women. Go ahead to the next slide. So, you know, the idea that there are factors that are protective for folks. So things like spirituality and meditation are helpful in terms of managing situations that are occurring. Of course, the strong desire to protect children. And so seeking help for the safety of the children. So that's an important protective factor. And then socio-cultural factors, like things like familism. So closeness with the family, you know, the sense that it takes a village. So having others in your life as helpful factors is important. Faith and religion are important in terms of healing. Cultural and family stories of survival and strength. You know, in being engaged with your cultural identity, we know that is an important factor in terms of having a strong sense of self and increased self-esteem. Contact with community or support networks are of course important in terms of being protective factors. And then having family members or providers who are not judging them and are keeping tabs on the family, especially in terms of safety. Definitely access to linguistically and culturally sensitive information and care is important as a protective factor, and of course, a safety or security plan. Go ahead to the next slide. Now we can also think about what might be risk factors or barriers in terms of getting the help that is necessary for someone in an intimate partner violence situation. And so while social cultural standards could be protective factors, they might also be risk factors. So the idea of wanting to keep a family together, so not wanting to air your dirty laundry might limit help seeking. Of course, the stigma or the taboo nature of talking about intimate partner violence is a risk factor. Immigration status, so fears of deportation, like I said before, and then lack of access to culturally appropriate information and care. And then we also know that Latinos are highly concentrated in low qualified and underpaid occupations compared to the general workforce, which again, in terms of being frontline essential workers, there's risk in terms of COVID infection. And then, it could really lead to economic dependence on the abusive person because of financial stressors. And again, the desire to protect the children from disruption, while it's a protective factor so that, a person may want to seek help for their children, it could also be a risk factor or a barrier because you don't want to disrupt the family. Next slide, please.
So if we think about everything that the one that just shared, intimate partner violence does not only affect individuals, but it affects the family. It affects the quality of relationships and interactions between individuals. And as we uh, mentioned at the beginning, it affects children. Next slide, please. If we think about, can you go back one? If we think about the primary figures or the parents, domestic violence or intimate partner violence has an impact on the mental health of the individuals. And we know it has been associated with post-traumatic stress, with depression. In terms of physical health, it has been identified as a major public health issue, particularly for women. It has been linked to a number of adverse health outcomes, including health injuries, exacerbation of existing health problems, increased risk for sexual transmitted diseases, and premature labor and delivery. In terms of the parental role or function, many of the parents that I work with report how they want to make up for the stressors that the children have experienced, and then they have a difficult time sometimes setting limits, and the emotional and the physical consequences of the violence itself can compromise the parent's ability to, and we're going to talk a little bit more about that, to assess danger or to be present. And of course, that has an impact on their parental function or their role. Also, children, as they become more aware of what is happening, might question the parents' possibility of keeping them safe. And all of that has an impact in how the parent is perceived and in their authority. Next slide, please. So in thinking about the impact on the child-parent relationship, particularly when we are thinking about very young children, the parent's possibility of establishing and keeping an empathic relationship with the child, of reading, we think about young kids, is so important that we are able to read their cues if they don't have language, and to try to understand what they need, why they are crying, and particularly tolerate their dysregulated behavior and emotions. And if you can imagine, if a person is very stressed and afraid of their survival, that becomes very difficult. And as what I was mentioning before, these adult or these but figure parenting figure might not be able to recognize danger, or might overreact to circumstances that are normative and overprotect the children or be in a state or a constant state of hyper alertness, and that also impacts the children. It's not unusual in the stories that the families I serve tell me that the children take the role of the caregiver. So very early in their lives, they are aware of where important documents are, or are aware of the danger of, of the situation when they should be playing, or they should not be concerned about adult matters. But unfortunately, that is one of the consequences of intimate partner violence. And something that is very important to understand as providers is that the children and the parents can serve as traumatic reminders for each other. So even if they have left the the abusive situation, at any moment the child can remind the parent of the abuser, or something that the nonviolent parent says or does reminds the child of the abusive situation, and that obviously impacts their relationship, and then it can give place to relational trauma, so to abuse or neglect in that specific child-parent relationship. And this is why having an awareness of this and having these conversations is so important, so we can stop those patterns of intergenerational trauma. Next slide, please. So in this picture, we can, next slide, please. In this picture, we can see how on the left side there is a picture of a little boy, actually, that who is representing himself as the tallest member in the family. And next to him is to the left is the sister, and to the right is the mom. And on the other side of the wall is the abuser, who is yelling and trying to get into the room. So here, this is a representation of how this child is seeing himself as a protector, and reflecting on how there is this change of roles in the family. Next slide, please. So for children who are in living and witnessing this type of violence, the loss of sense of their parents as reliable protectors or a secure base is very intense. It is very confusing to know who is safe, who is not safe, particularly if you are at an age where you are still trying to figure out if monsters exist or not, and because actually the monsters are living with you at home. And it's not unusual that they also experience very intense and contradictory emotions about each parent. For one of the aspects that is very difficult for a lot of the non-offending parents is that the children miss the abuser, and it's because for them it's not all or white, right? They have memories of the abusive parent, good memories, or memories when that person might have been playing with them, or maybe that person was taking care of the child and not directing the violence to the child precisely. And there is an intensification of fears that are developmentally appropriate and that become actually not normative. And the fact that the parent and the child share the trauma, that just increases the severity of the situation, because, as I mentioned before, they can serve as traumatic reminders to each other, and that has an impact on their attachment or their relationship. Next slide, please. So Here, this child is depicting how there is not a safe or place, or home is not a safe place. Actually, it looks very scary. Next slide, please. And here, the child, the mom is represented with blood on her face, and you can see the desperation in this child that she is representing herself. Next slide, please. And then here, this is a representation of her mom, and as we can see, this mom looks might look very vulnerable, but also very scary. So that is one of the significant aspects again of domestic violence, is that it robs children from a sense of safety, and that is why it's so important to work on repairing the relationship, particularly the relationship with the non-offending caregiver. Next slide, please. So the domestic violence and or intimate partner violence has an impact on the child. As we can imagine, it has an impact on their possibility to regulate, physiologically regulate. So how like if they how they sleep, eat. We know that it has also an impact on the possibility of regulating emotions, and it has been associated with cognitive impairments, learning disability, and also the psychological dysregulation. So it disrupts all aspects of normal development and brain development. If we have more time, we will continue explaining each one of these aspects more extensively. Next slide, please. If we think about very young children, so sometimes there is this idea that babies and young children are protected because they are very young and they are not aware. However, they are very sensitive to changes in the environment. They are, the attachment with their parents is providing them a sense of what is safe and not safe and what's happening in the environment. So they might show self-regulation difficulties, intense crying, or changes even in their skin color. Like they might become very pale, or they might have a colic or feeding difficulties. And then sometimes these signs of stress in children go unnoticed. They might also have intense separation anxiety because they are worried about their parents, and that dysregulation is reflected in self-injurious behavior. They might engage in repetitive behaviors and headbanging, and sometimes those signs of stress are confused um, uh, with other difficulties in childhood, and can lead to misdiagnosis. Or sometimes a child who is very experiencing a lot of these stressors and showing signs of traumatic stress, those symptoms might be confused with, for instance, autism, or later on with ADHD. So it is really important to be mindful of why, or keeping in mind that it also can be, these symptoms can also be related to trauma. Next slide, please. As children move more, they are able to move and have more independence, then also their anxieties change, and then the concerns are about their body integrity, and then the symptoms or the stressors might show in terms of like reckless behavior, or they might become prone to accidents. They might not engage in exploration or play. They might become very angry, And again, being away from their parents is can be very, very scary, and new fears about their body and about like dogs, or become very extreme, or things that they were not afraid of before. And it's not unusual that they also show regressions in their development. So, for instance, if they were already toilet trained, they might soil their clothes again, and they might show also psychosomatic behaviors. I have a lot of little clients who have headaches and stomach aches that are non-medically related. In this next slide, please. And this is also present. Some of the same the symptoms are present in preschoolers. And one of the aspects about these age range is that they are in a state um, of magical thinking. So the association of whatever is happening at home and feeling responsible for that is not unusual. And that is why it's also very important to help children make meaning of what is happening at home, and to have conversations, hopefully in collaboration with the parents, to help them understand that this is not something that they caused because they didn't eat, or because they didn't follow some direction, and that the domestic violence or the violence at home is the result of that. Wanda?
We're hoping to walk you through a case example so that a little bit of interaction between all of us in terms of thinking through, ways in which this case or a typical case might cause one to feel as a therapist, and also ways in which to intervene. So we have Rita, Juan, and Ariana. Rita is 30 years old, lives with her two children, Juan, who's 5, and Ariana, who's 2, in an apartment shared with another family. They immigrated from Mexico with Juan 4 years ago, escaping a domestic violence situation. Rita met Ariana's father on arrival to the US, and from the beginning, he was emotionally and physically abusive to her. She separated from him about a year ago and obtained an order of protection. Both Juan and Rita are undocumented. So in January 2020, the family had been referred to therapeutic services by Ariana's early intervention specialist because of concerns about the relationship between mom and Ariana and the children, and delays in Ariana's development and the impact of different traumatic stressors on the kids, including intimate partner violence. Go ahead to the next slide. So the family was assigned a therapist specializing in dyadic or child-parent psychotherapy, and they started conducting the evaluation and the engagement process in February. The therapist met with Rita in person 3 times and once with Rita and the children. Now, at the end of March, due to the social distancing orders, the session was canceled. The following week, the therapist tried to make contact with Rita to start telehealth sessions, but she did not answer. 2 weeks later, she responded and said she lost her job and that she was living with Ariana's father. Next slide, please. So we can think through about the symptoms, both pre-COVID and during COVID. And so for the mom, she was already experiencing difficulty sleeping, anxiety, feeling hypervigilant, related, of course, to the political climate, fears of ICE, and fears of separation from her children. She was having intrusive thoughts. She was having a hard time connecting emotionally with the children and understanding the signals that they were giving her. Now, during COVID, of course, these symptoms were exacerbated because of unemployment, financial concerns, getting harassed by the landlord, and then, of course, fear of death of relatives in Mexico and fear of Ariana's father. So the symptoms included nightmares, anxious eating, irritability, dissociation, so leaving, her mind, leaving her body, increased body pains, difficulty concentrating, and increased memories of the trauma and panic attacks. For the children, prior to COVID, Juan, the 5-year-old, would say things like, "I'm dumb." He was hypervigilant, showed signs of being withdrawn and had difficulty separating from mom. During COVID, Ariana had increased tantrums and was defiant. There was irritable behavior, had a hard time sleeping, and frequent crying. And Juan had increased withdrawal and separation difficulties and difficulty sleeping. So these are all signs and symptoms that Kahneman just talked to us about, and we can see how it all happens within a family. Next slide, please. And so just for discussion and in the chat box, if you might answer these few questions. So let's start out with, if you were the therapist of this family, how would you feel knowing that they returned to the abuser? No surprise, empathy. She clearly felt like she had no choice. I would feel a little defeated, disappointed, but understanding why. Right, so there's elements worried for their safety, so disheartened. So while we might have some empathy about the situation and understand why this would happen, the financial burden, the dependence on someone else, I mean, one can't help, right, as a human being, feeling sort of disheartened and of course worried for the safety. I would feel powerless yet willing to support her, right? So that's sort of the conflict. We would feel a little powerless, empathetic, wanting to help. So how would you intervene in this wanting to help? Someone said it would be a bit frustrated and worried for their safety and well-being, and that it would point out a bigger issue at hand. Ensure their safety plan is in place. Do a safety plan. Safety plan, I imagine, would be a popular one. And so to continue in terms of intervention, what would be a short-term goal, but what would be a long-term goal? So folks are starting to learn more about what it's like at home. Is there a safe time to call? Can I leave a voicemail? Make sure that she knows what to do if she needs help, then reevaluate her goals. Short-term goal would be to ensure that resources are in place, look for a DV shelter, offer the opportunity for both to participate in crisis counseling related to COVID-related stressors and revisit the safety plan, empower her to follow her therapy. So definitely lots of ideas and all things that make sense, right? And safety planning being sort of the primary thing. An opportunity to bring the dad in for counseling and make sure, I don't know if we're still on, make sure she has a cell phone the abuser doesn't know she has. Okay. And I think the last question was, would there be any reason not to continue working with this family? Short-term goals would include to ensure all immediate needs are addressed. And absolutely no from Catherine in terms of not working with the family anymore. The only reason would be if she would want to discontinue services. You should still work with the family, try to do safe check-ins with the family, gather resources that can support the family. So thank you everyone for all your wonderful answers. We somehow lost the feed of our slides, but we can
yeah, we can continue. I have a hard copy.
yeah.
So now we are going to start discussing some elements of intervention, and independently of what your role is, we thought about some elements that you could use. And one thing to highlight again, that because we are talking about very young children in this context and their families, it is important to hold different lenses here. So to hold a developmental lens and thinking, as we have been discussing, what are the very specific needs of this population. And then when we are discussing or thinking about Latin American families, to keep in mind the socio-cultural context. So what was the socio-cultural context prior to immigration, and if the immigration is pretty recent, in the socio-cultural context now, and with all of that, how historical trauma is playing a role in all of these. I have worked with families who are indigenous families from Guatemala or Central America, and they have very specific needs. And sometimes, for instance, the assumption is that they speak Spanish and they might speak a different language that is the language of their group. And so in thinking about all of that, what is the ecology of the family in terms of inequities? So what, again, being undocumented or being an indigenous undocumented woman of a single mom means in the context of a racialized society, and then holding a trauma lens, and then very, very, very importantly, holding a lens of self-awareness and self-reflection. And I want to stop for a minute and think about this piece about self-awareness. And I am going to read tenet number 1 of a set of 10 tenets that are focused on infant mental health, and that are really inviting us to think about how our biases, independently of where we come from or who we are, we all hold biases that are influenced by our history, by our profession, by what we have learned as workers. And we have to also be very mindful that because we are in the United States, a lot of the paradigms or the models that are being used when treating families are based on Eurocentric models, and they don't necessarily apply to Latin American families. And then so we have to have, or it's very important to have an awareness of that and advocate for interventions that are culturally and sensitive. So I'm going to read this tenet, and it says, constant self-awareness leads to better services for families. Working with infants, children, and families requires all individuals, organizations, and care systems to reflect on our own culture, values, and beliefs, and the impact that racism, classism, sexism, ableism, homophobia, xenophobia, and other systems of oppression have had on our lives. So we can provide services informed in diversity and in tune with the culture of those we serve. So this tenet is really reminding us that this work about social justice work is not about the other, but it's really thinking about ourselves first and being aware, as I was mentioning, of our biases. And even if we are from Latin America, that doesn't mean that we don't have certain expectations about how people should care for their children. And I know, particularly for me, when it comes about violence and exposure to violence for children, I have to be very aware of what that brings up for me and stop or be aware that I need to stop judgment. Next slide, please.
I want to apologize, Carmen and Wanda, because I was without power. So could you let me know which slide is the correct one?
Oh, okay. So you can go to the next slide. So I think prior one.
Thank you, and I apologize to everyone.
That's okay. So in thinking about interventions with telehealth, it's very important to be mindful about what telehealth, the great tool that telehealth has become, but also how it has opened the space to our clients or our patients' homes. And then what does that mean in terms of intimate partner violence? So many communities have implemented creative solutions and to protect COVID-19 victims and prevent violence. And it can be a very useful tool for sharing resources and support those survivors or victims. However, we have to be very careful when we might be asking questions, and because we have to always assume that the abuser is in the home, or that the abuser might have control of the computer or the phone, and be listening. So it's something that we wanted to emphasize as we will be discussing telehealth a little bit more. Wanda?
So in terms of the next slide, please. Thinking about telehealth, really it's important to implement universal precautions, and that is towards the eye of looking at safety. So not letting family members serve as interpreters is important, assuming that the person is not alone, like Carmen mentioned, even if they say that they are. Assume that there's abuse, even if it's not disclosed right then and there. However, it's important not to ask direct questions about abuse or safety, again, because the abuser or the aggressor may be around. So asking questions like, how are you and the children? How are you and your partner handling the current situation? Are there any issues related to COVID-19? And important to really follow the person's signals in terms of what information are they comfortable sharing. If the person says that there are safety concerns, be careful about exploring, asking if they can provide more information about what concerns them or the type of help that they need, and being prepared to change the subject at any time. Next slide. So specific to if the person discloses that they are not safe, you need to be ready with short questions, yes or no questions, to determine how urgent the situation is and whether the person can stay on the phone. So for example, you might say something like, if you fear for your safety, you can call 911 at any time, or would you like me to call 911? And of course, being sure to gather the information about where the person is. Asking them if they'd like the number for an emergency line, letting them know that they're available 24 hours a day, and to help them think about areas or options in their area. And reminding a person that when they use the phone or a computer, if the abusive person is not seeing or present, to delete the history in the computer or on the phone memory. And if the person is not in immediate danger, offering other ways to help, to find help when it's good for them. So for example, giving them the number of a DV program. Go ahead, next slide. And then, thinking about how to protect children during incidents of intimate partner violence, really safety is paramount. So teaching the children when and how to call 911, choosing a room where they can go if they're feeling afraid, and teaching them to think of something to help them calm down when they start to feel scared, right? So helping them regulate. Teaching them to stay out of the kitchen, the bathroom, or any other area in the house where they can be objects that a person can use as weapons. Teaching the children never to intervene. As much as they may want to keep mommy or daddy safe. It's important that they do not intervene. Helping the kids make a list of people they feel comfortable talking to, with whom they can share what they feel, other adults in their lives. Perhaps if they have to be enrolled in a therapy program, if they're showing symptoms or symptoms are becoming worse, then that's a person that they can talk to as well. Next slide, please. So outside of the house, teaching the kids to leave the house if this is an option, as soon as the violence begins to escalate, in a place where they can go. Maybe there's a neighbor, maybe there's a family member close by that they can go to. Having a code word to tell them to leave the house, of course, making sure that they're not going to tell anyone what the code word is, and identifying people that they can go to for help. Next slide. In terms of how an abused person could protect themselves, this is an important conversation to have with with clients. And so thinking about, helping them identify, so when and how intensely the partner uses violence in order to help them think about when are the times that are most risky, and when danger may escalate. Again, identifying places in the house that are safe, where there are no weapons, telling them that it's important that during violence, don't run to where the kids are because the kids could get hurt too. And if the violence is inevitable, talking to them about ways in which they might be able to protect their body, their head. Always try to have an easily accessible phone, memorizing any phone numbers that they might need. Of course, calling 911 if their life is in danger. Any weapons in the household need to be kept out of range or locked up. Getting used to leaving the car parked facing the street and with gasoline in the tank, if that's something that they have available to them. Talking about, body safety in terms of what they might wear or avoid wearing: handkerchiefs, scarves, long necklaces that could be used as weapons. And then having several credible reasons for why they might need to leave the house in the, at any time of day or night. Next slide. And then, of course, part of the safety plan, right, is teaching folks to keep their important documents and those of their children in a safe place, letting perhaps a trusted family member or a friend or a neighbor know where they have things. If tensions rise, trying to isolate yourself in the house, without falling into conflict, trying to de-escalate danger. And of course, I realize that that puts the onus on the victim. But these are ways in which their strategies for keeping safe, being aware that we're not saying danger is your fault, but once danger is there, what can you do? If there's danger of violence, finding out where there are shelters in the area, or whether the state has a state paid hotel stay program. Can you text a shelter? Dialing 911, for instance, in New York City, it's Safe Horizon that one might call to get to go to a shelter. Allowing friends or neighbors whom you trust to know about this information and making a plan with them, practicing with the kids, teaching them what the plan is, which again can be heartbreaking and difficult, but it's in the interest of safety, of course. And having an alternative plan in case the children, they're kids and they might tell, or the partner might discover the plan. And so in order to be safe, having a plan B or plan C. Next slide. Go ahead, Carmen. You're muted.
Something that I wanted to reflect on is that, of course, we are sharing all these strategies and thinking again about the situation where a parent is trapped because they don't have a lot of choices, because they are all these determinants or structural determinants um, that have placed the person in this situation. And of course, what we all will hope for is that the children are not exposed to violence. And but this is again in thinking about safety, and in thinking about safety in the context of COVID-19. And again, in linking to that, in linking also to that aspect that I was mentioning before, how children are aware of everything that is happening, and that their young age is not really protecting them from the anxiety and the impact of and the confusion of what they are witnessing. We usually encourage parents to speak to children, or to explain to them what is happening in developmentally appropriate ways, so children can make meaning of the situation and don't come up with stories that because that is what they would do, and because of their young age, depending on the age, and their, they have, as I mentioned before, they are in a stage of magical thinking. The conclusion would be a wrong conclusion, and it usually would be related to having them the responsibility of what is happening. We want to prevent or avoid that. However, before engaging in a conversation about what is happening with the child, we also recommend parents to consider the safety, if it's safe to talk about these with the child, or if that is just going to increase or exacerbate the violence. So it's something to be very mindful about. Then also we encourage parents to take some time to think about how they are feeling before engaging in these conversations, and what the domestic abuse has represented for them. And then also consider what is their perception about the impact on the children. So it's really important to think about the age and developmental stage of the child before engaging in these conversations, and to choose, like if you are going to use toys or a book, and then also that the conversation does not need to have a lot of information. It just needs to have enough information to dispel all these fantasies or ideas that children have sometimes about to make meaning of what is happening in their environment. And again, with these ideas that the best people to help children make meaning of their world, and help them regulate, and help them dispel fears, are the parents, and in this case, the non-offending parent. We also recommend avoid involving the children in adult conversations or giving more information that is needed. And as Wanda was saying, children ask questions, and that those questions might be difficult, and the parent might not know how to answer at the moment, and that is okay to say I don't know. It's okay also to admit that you have a lot of intense emotions, or that you are sad or scared, and to provide that language to name those feelings. Next slide, please. Next, please. In thinking about oops, in thinking about I lost my connection, but I am still connected by phone. So some of the recommendations also, if you engage in a discussion with a young child, is to start the conversation with very simple words, or if the child is verbal, to ask them what do they know or what do they think about what has been happening, and use supportive messages like mommy's here to listen to you, daddy wants to know how you feel, and acknowledge that their experiences, for instance, that the abusive person is hurtful or scary, and that they might be having or feeling a lot of intense feelings, or they might be confused, and to make clear again that the violence is not their fault, and that violence also is not acceptable or a way to solve problems, and that is not their role to protect mommy or daddy or the um, or the parent of the paternal or parental figure. Next slide, please. And Wanda was mentioning the safety plan. So if children are old enough, it will be important to clearly explain a safety plan. Of course, it becomes more challenging with younger children. And so that is something to keep in mind if you have a very young child. As Wanda was saying, the concern should be more like where they are located physically, or how to ensure their safety, and then use also words after a situation to explain, very simple words to explain what just happened, and assure them that that you or the caregiver is doing everything in their hands to keep them as safe as possible, and that you love them and you care about them. And also, it's very important to be aware of when the children are done and cannot, they don't want or they cannot tolerate having a conversation. And these conversations don't need to happen at once, and they are an ongoing process. And it's more like how do you build a space to keep having these conversations, so then the children know that you are available, the children know that you are listening, and that they can come to you with their questions. In the interest of one, and then lastly, this piece about maintaining hope. So how the importance, Wanda mentioned the rituals and the cultural elements that we all have in our families, or that we bring in our as part of our socio-cultural history, and how you can use those to maintain hope and connection. And that also, if you have the opportunity to allow your children to be connected with others in a safe way now, with, of course, with the COVID situation, this becomes harder. But identify activities that you and your children enjoy, and keep routines as much as possible, in a sense of predictability for them. And just engaging in relaxation and breathing exercises. Sesame Street has, and we have also some resources in the last slide that can be helpful. And I am going to stop there to take questions, because we are a little bit over time. And someone is asking when is the. So we are going to take questions now.
Thank you, Wanda, and thank you, Carmen, for an excellent presentation. As always, full of information that all providers can use and help them guide them through these difficult discussions, also with children and families. We are monitoring the chat questions, so participants can enter any questions through the Q&A. Yes, I'm keeping tabs on it. No questions yet. We want to thank everybody that has uh, that has stayed with us until this moment. Thank you for paying attention and giving us all your wonderful feedback. We've been receiving some great feedback, wonderful presentation, excellent webinar, a lot of valuable information the participants mentioned.
I will just add that the last few slides were about advocacy and public policy, and those will be in the frequently asked questions. So you'll get all that information, and you'll also be able to access the slides. So you're not going to miss anything.
Yes, we will recording. Thank you, Wanda, for reminding us that we will be posting this recording of the presentation in the next few days in our webpage. We have posted that in the chat. Also, we will be sharing the slide deck with all of you so you can benefit from this information. And also, we will be providing you with the FAQ document that we develop after each webinar, so you can go more in depth into more specific topics or items that our presenters would like to touch on. A few reminders before we go. Please fill our evaluation. You can access us through our QR code in screen scanning with your phone, or through the SurveyMonkey link that you have on the slide that you're viewing right now. Like I mentioned, this helps us to continue to provide free webinars and technical assistance throughout the nation so we can better serve Hispanic and Latino populations that have mental illnesses.
So
We
there,
have a first question here before we leave. What specific words do you use with children under age 3 where there is an IPV case?
I tend to use things like, um, honest things like there's been scary things that have happened at home, you know, for the sake of generalizations, sometimes daddy has hurt mommy, or daddy sometimes uses his body to show when he's angry and he might hurt mommy. And talking about in that, that causes, when kids experience that, they have big feelings and they might be very scared. And yeah, I use that voice. I don't know, Carmen, if you wanted to add more, but those are the kinds I tend to say.
I think that is, I was saying, no, I don't want to have anything to add because those are the words that I use and focus on describing possible feelings, like that. It's scary, it's confusing, and, and then highlight the intention of protection of the caregiver. And something that I see mentioned many times is the lack of access to internet, and I agree that is one of the disparities. It seems that, like, from what everybody says, that it's so easy to access the internet, and that there are laptops that schools are providing to families. However, it is very, very complicated. And then for some parents, there is the technology piece, and then the being in a state of mind to be able to help children with Zoom, classes. And then some parents are not able to navigate all of that because they don't have an understanding of the technology or access to the technology on a reliable way. As we see, so today we have probably very good connections and we got disconnected. So
And I will add that there's also the financial burden of it.
exactly.
So while schools might be giving internet ready computers to the kids, there are schools that don't have those resources, and then parents can't afford to pay for Wi-Fi and data and all of that. So that's an added layer. I know that there have been creative ways to kind of get at that in terms of maybe using resources for instance, at the hospital, they've been working on ways in which we might be able to supply community members with like tablets or something like that, that are internet enabled, either for medical care or, I'm pushing to do that for our program, for families to have access to therapy, so it's a really complicated and loaded situation.
Wonderful. Thank you, Wanda and Carmen, for that answer. I've been monitoring here the Q&A and the chat. Besides some more great comments on a wonderful presentation, we don't see any more questions. There's something that just came up. Just another comment from one of our participants. I think that with this wonderful information and with these resources that you have shared, we can conclude this webinar, and also remind once again participants that will be sharing the slide deck, the recording, and the FAQ for further information. Once more, Wanda, Carmen, thank you for sharing this wonderful information with us.
Thank you. Thank you for attending and staying. Thank you.
Excellent. Always a pleasure. Have a great day. Thank you for everybody that attended today.
Thank you, everyone.